Okay, so I'm here today with Molly McNamara, our new exercise physiologist. So Molly started with us in January, and she last year ran a osteoporosis program when she was a student at Vector Health, completing her practicum hours for James Cook University. And that program was a real success, and so we've decided to restart that program on an 8-weekly basis. Program starts in April. And Molly, what did you enjoy about running that program last year?
So I enjoyed helping the individuals involved in the program improve their quality of life, and I enjoyed teaching them safe exercises for them to go and perform at home after the program had finished, as well as educating them on about the disease that they had, as most of them did not know very much about it at all.
Okay, that's awesome. So the program this time, it's going to be fairly similar. We're really focusing on trying to provide structured education to each person in the program. And the program's designed for people with low bone density, osteopenia and osteoporosis. So that's different stages of the disease profile, isn't it, mate?
Yeah, so there's different stages.
All right. So who are you looking for to come to do this program with you?
So I'm looking for anyone that's at risk of osteoporosis or currently has osteoporosis. So we want to find people in the community that have suffered from fractures before or are at risk of suffering from an osteoporotic fracture.
All right. And so at risk of osteoporotic fracture, so if you're anywhere over 50 years of age and you're noticing that your balance or coordination is becoming more difficult to do, things like walking upstairs, maintaining balance on unstable ground, like if you're in the garden or you're out walking along and you have to move sideways quickly and that becomes quite challenging, or just trying to stand and balance and reach for objects, they're the type of symptoms that you get of your balance suffering. So as we become older, we know that the neuromuscular system, so the connection from your brain to your body, really slows down. So what we try and do is, in programs that Molly did last year, we did a lot of balance work, we did a lot of coordination work, trying to do some reaching and balancing at the same time in a controlled environment, so that then people improve their balance, improve their coordination, and therefore become less falls risk. So a lot of people talk about falls risk and they don't really know what that means. If an osteoporotic person falls down, the likelihood is that you will sustain a fracture and your life expectancy shortens once you have a fracture, which is really sad. So, Molly, just tell us a bit about the silent disease profile that they talk about in osteoporosis.
So osteoporosis is known as a silent disease because there's many people out there that do have osteoporosis but are unaware of it until they actually sustain a fracture. And then they go on to find out that they do have osteoporosis, so they never knew that they were at risk of easily getting a fracture or having a fracture. And
once upon a time, like, women used to mainly get osteoporosis. Do men get osteoporosis as well?
Yes, so just as many men do get osteoporosis as women. Most people think it's just a disease that women have. However, men do get this as well.
All right. And in the program itself, what type of exercises are we going to do to help people?
So we'll be focusing on weight-bearing exercises. So this is to provide the bone with a stimulus to grow and repair. Resistance exercises, so to increase and improve our muscle mass, as well as balance and coordination exercises to help improve our posture, so we're not putting as much stress onto our spine.
All right. And in terms of some testing that we might do and people can do at home, what's an easy strength test that you can do at home to assess your general strength capability?
So just general strength, we'd be doing a 30-second sit to stand test. So sitting down, standing up, seeing as many times as you can do it within 30 seconds. And we want to try and aim to get to about 15. So that's testing our strength endurance of our legs.
Yep, so that's really good. So people can test that at home.
Mm-hmm.
So if you are in that 50 and over age category and you can do 15 to 20 sit stands, then that's a falls management risk factor. It's a strength risk factor decreased. It's in endurance, so a strength endurance risk factor that you're decreasing. If you can't do more than 15 because of pain or discomfort, or it's just quite difficult, then that's something that can promote you to come and maybe do this program so that you can improve. So what's the main tests that they do for bone density, and how do people get involved in sorting that through?
So bone density tests, if you talk to your doctor, they can send you to get a bone density scan. And if you're on a Medicare plan, your doctor can get you this free of charge. All
right. Excellent. Okay, so the main takeaways that we want to give to people today are that you've got to make sure that as you age, so over 50s really need to be mindful of their balance and coordination. And that sit-to-stand test is something really basic that you can do at home to assess yourself. So if you've got a mother and a father, uncle, auntie, a member of your family, a friend, grandparents in particular, something that you can go away and just ask them, how they go with that, because the program is designed to help people. It's not designed to be an elite athlete program. It's not designed to make you the strongest person in the whole world. It's designed as a nice, comfortable environment to come and work in, and it's run by someone who's specifically trained to offer services that are clinically proven. So, plenty of research has gone into what exercises are good for osteoporosis, and so we're going to follow that when we deliver the program. All right, Molly, thanks very much.
Thank you
for coming along today, and we look forward to seeing you or maybe one of your friends or family in the program. Thanks.
Thank you.